My name is Kathy, and I'm in group two along with Colin, Santiago, Savannah, and Serena. And we'll be presenting on the problems facing science and their role in the pandemic response. So first of all, too much science is locked behind paywalls. Um, as I'm sure everyone knows that the research process and publishing research is very complex, and even after research is published, a lot of access is limited. 75% of access is limited to research literature, actually. And to access such research, it usually costs researchers or students or just the general public anywhere from $30 a month to 20,000 a year. As you can see on the graph, that a lot of um, countries do not spend nearly as much as the US and China does on science spending, at least. And a lot of this spending does go towards research and research for for funding the cost to get research. And this doesn't limit just researchers. Of course, it limits all people who is interested in reading any type of research literature, and it specifically impacts the countries that may not have as much funding to spend as the US, China, and EU does. And it impacts, again, researchers, educators, students, and the general public. Specifically with the coronavirus, you can see that just within the past year, the number of publications just for COVID-19 papers has tremendously increased. It's much, much greater than usual. And this affects closed science affects this because since research is publicly funded, it limits the amount of knowledge that the funders have on research. So when it's proposed for funding, the funders may not have as good of a understanding as they could because of closed science, and they would have to pay in order to fully understand a topic. And of course, this would prevent the general public from understanding treatments and as well as study participants when they're given a possible treatment, they may not completely understand it. This would result in either doctors having to spend more time with patients, or patients would have to go out of their way to understand their condition. And of course, this will also lead to a increased chance of misinterpretation of science, just because people do not have the resources to go and read research that has been peer reviewed and fact checked properly. For COVID-19 specifically, this limits the healthcare providers from accessing new research, especially in countries that are less developed, those countries that are part of institutions that do not have the funding to spend thousands of dollars on just research papers alone, given that funding for research is often limited as is. And this prevents patients from understanding the severity of conditions and the pandemic. Of course, also with healthcare workers being extremely busy with a pandemic as well, they may not have as much time to go as in depth for patients and the cares of patients to explain the extent and in detail as they could, which also leads to false information. And overall, with closed science, because research is so hard to access and so much money has to be put into it, this has the potential to slow research and advancements and also the prevention of COVID-19. And also, this can now be expanded to with vaccines as well and its effect on populations. And in the graph here, you could see how COVID papers have also been double, if not more, in the number of submissions as any other topic. So to fix closed science, a lot of people are urging that first it needs to be shifted from focusing on profiting off science journals or any type of journals, in fact, and to shift towards the actual focus of science, because many of these publishers are focused on profiting off of all this research. And a lot of people are urging to publish in open access journals, but of course, journals can never be completely free because someone needs to get paid in order to publish those research journals. And however, there is a conflict with this because open access journals may not be as well known, so researchers are more hesitant because a lot of times getting published in a top research journal will lead to promotions and grants and other opportunities. So a lot of people are encouraging nonprofit publishers as well, just because those will still have researchers be paying to get published. However, it may lower the costs and make it more available to others. One that I thought was really interesting is that a lot of people are pirating research papers through Sci-Hub, and this is more common for, of course, the institutions that don't have access to such a wide database of research papers. People also look towards to preprints of research. And of course, these are not as long-term solutions. However, until greater institutions collectively decide to all switch over to a nonprofit or more open access form of research journals, the temporary solutions are more popular. Some people are also researching immediate or they're publishing research immediately after they get results in a form similar to a blog online. And however, there is a big concern that because with abolishing these paywalls, these will lead to scientific free riding.
So my topic that I wanted to talk about was how science is often poorly communicated to the public, and I wanted to specifically address how this generally occurs and then how it's occurred during the COVID-19 pandemic. So there's an issue in research with misrepresenting or exaggerating findings of studies. One review found that positive word use in research papers has increased dramatically over the years. As you can see in the graph, they refer to it as hype. Basically, researchers might be overhyping their findings, using more positive words to try and encourage readership of their research. And additionally, there have been issues with university press releases exaggerating research findings, claiming causation when there was only correlation, or claiming the research shows implications or gives health advice that it actually doesn't. And this is caused by universities and the media attempting to increase public interest in various studies, and also by researchers competing for funding. But the effects can be really dangerous as they can encourage misinformation and decrease public trust in science. So during the pandemic specifically, there were a lot of issues with health officials communicating with the public in a consistent and helpful way, especially towards the start. For example, the CDC waited over 5 weeks after community spread of COVID-19 was documented in the US to start advising the public to wear masks. And this was due to a few concerns. First of all, there was a concern the public would buy and hoard masks, keeping them away from healthcare workers who especially needed them, or that the public might become complacent and fail to follow social distancing guidelines if they relied only on masks. However, many experts are now saying that this delay in communicating with the public about the potential effectiveness of masks was a mistake, and it should have been done sooner because we now know that even cloth masks do help reduce the spread of COVID. So there have also been a lot of issues with the public understanding of COVID-19 and where the public is getting their information from. So too often the public has been affected by sort of political beliefs rather than actual scientific findings. For example, this study in the New York Times found that 1/3 of Republicans didn't know COVID could be spread asymptomatically, which is a main concern because a lot of spread is done asymptomatically. And Democrats were more likely to exaggerate the severity, believing hospitalization rates were far higher than they actually were. This is just showing how the public health officials were not the main source of information for a lot of people. They were getting their opinions basically based more on politics than on the best knowledge of research at the moment. Finally, if we're talking about fixes to this issue with communication and research, it's important to teach scientists and public health officials how to properly communicate with the public. For example, avoiding language that would be inaccessible to the general public and making sure that any teaching the public is done in a way that can be understood. Finally, changing research incentives is important, and this is touched on multiple times throughout our presentation because there's a lot of value placed on research being noteworthy, and this can lead to basically encouraging more exaggeration of results, trying to make sure that it's always shown as being noteworthy, which is obviously a problem. And finally, I think one of the most important ones for the COVID-19 pandemic in specific is improving the scientific literacy of the public. A well-educated public could be better able to understand research claims and potentially avoid misinformation that was a major issue during this pandemic.
Hi, I'm Colin McKenzie, and I wanted to discuss the fact that peer review is broken. Next slide, please. So just a quick overview of the current peer review process is that papers that are candidates to be published are examined by other experts in the field, these reviewers. The way they're run currently is that they're usually single-blinded, meaning that the author doesn't see who the reviewer is or the reviewers are that are reviewing their paper, but the author is known to the reviewer. The papers can be rejected, they can request changes, or it can pass through for publication immediately. And the idea of this is to ensure quality and academic rigor. Next slide, please. So here's a little diagram to show kind of the process of how these papers get published. So first, it's written and then reviewed by an editor. If the editor accepts it, then it goes to the peer review process, which is shown here in the red box. And there you'll see the three options: rejection, exception, or needing revision. And then from there it can be evaluated once more. Next slide, please. So what are some of the current problems that we have with the system? Oftentimes we can see rather large delays in papers getting published, and sometimes there's a lack of thoroughness. These both stem from the fact that the people who are reviewing these are doing so voluntarily. They're not getting paid to do it. And oftentimes this means that they can end up being kind of put off until later if, the researchers are very busy doing their own things. And then there's also the issue of bias from reviewers, depending on whether what they're reviewing, if it might be competing with some of their own research that they're trying to get published at around the same time, that could, present a bit of a conflict of interest. And ultimately, the biggest one probably is that mistakes and poor quality submissions sometimes do slip through the cracks. Next slide, please. So how did we see this play out in the COVID-19 pandemic specifically? So slow publication during a crisis hurts response times when it comes to altering our practices and guidelines. So one way that we saw this was mask efficacy papers for COVID specifically. Towards the beginning of the pandemic, we had a fair amount of research indicating that masks generally are good in slowing the spread of disease in populations. But as far as looking specifically at whether it's how beneficial it was for COVID-19, there was a general lack early on of the amount of these papers, and it would have been really helpful to get these out even sooner so that we would have more definitive conclusions on what the public should be doing and what guidelines that the organizations like the CDC should be putting forward. There's also the fact that poor quality papers can propagate misinformation, and one of the ways that we saw this during the pandemic was the Lancet and New England Journal of Medicine both had retractions on the 4th of June in 2020. And Science magazine found at least 105 papers of the 200 they looked at, which still cited these retracted studies, even though all of these papers were published after the retractions took place. And so all of these, many of which were peer-reviewed papers, including in journals such as PLOS ONE, were they made it through the peer review process, and we're not, this issue of citing these retracted studies was not caught at all. And furthermore, like these papers, even before they got retracted, the fact that they made it through peer review as well before these issues were caught, the Lancet paper in particular disrupted a major trial of hydroxychloroquine for COVID treatment. Now, in hindsight, we know that hydroxychloroquine wasn't helpful for COVID treatment anyway, but had this been an effective treatment and a major clinical trial was disrupted as a result of poor quality information getting through, this could have cost a significant number of lives potentially. Next slide, please. So what are some possible changes that we could make here? We could change the anonymity in peer review. So we could make it double-blinded peer review, meaning that the reviewer and the author are both anonymous, and this could lessen potential bias from the reviewer and evaluate more on the quality of the content. However, this could still maintain kind of the delays in reviewing, since the reviewer isn't as pressured to complete the thing because it's not going to come back on them specifically for holding off on getting their review done. There's also the idea of open review, where both are known, and it's less likely for the reviewer to delay for long periods, which could lead to faster publication. However, this has the downside that it could discourage reviewers because reviewers may be more hesitant to be openly critical of other contemporaries, especially if they think that they might want to work with them in the future or need to maintain a good rapport with them. And then there's also the idea that more post-publication peer review. So even after papers go through this initial peer review process and get published, many advocate for a post-publication peer review process, which would continue to evaluate papers even after they make it through. And this could hopefully more quickly fix errors that slip through the review process. Next slide, please.
Hi, so I'll be talking to you about the money problem that we have in academia. Next slide, please. So why do we need money and how do we get it? Well, research requires a lot of money, as we know, not only to run studies, but in order to run studies, you need expensive lab equipment. And not only do you need expensive lab equipment to run your studies, but you need people to use the trained people to use the lab equipment and conduct these studies. That includes paying salaries. So where do we get this money? A lot of money comes from university funding. However, that is, for a lot of research labs, that is not enough to run the studies that they need to run and pay for the lab equipment and salaries. So a lot of research labs and PIs will focus on applying for grants. Grants can come from government funded grants or private companies. And getting this money is a lot of work, requires a lot of work, and it's very difficult. Next slide, please. So here we see why getting a grant is so difficult. Well, grants are extremely competitive, and the reason why are because grants are in short supply, and they're in short supply because the federal funding is plateauing. And in conjunction with that, demand is increasing. So we have more new scientists coming into the fields, applying for grants, asking for more money, and less researchers retiring. So we are increasing this demand dramatically, and the supplies are not increasing with the demand. So you see this conflict with supply and demand. This causes a lot of researchers to spend a lot of their time writing grants and not focusing on their research, and that could be very stressful for the lab and prevent them from conducting important research. Next slide, please. So why is this a bad thing, and how does this impact our COVID response? Well, this pushes scientists away from long-term studies. Researchers want to publish fast and focus on these short-term studies because grants are typically expire after 2 to 3 years. So it doesn't give researchers much room for long-term commitments. And this leads to a decrease in finding bigger discoveries because those are unlikely to happen in these short-term funding schemes. Another factor with that, with publishing fast, a lot of researchers will have the idea that more publications equals more money. And in the eyes of the investors, that is the case. Grants will tend to offer money to labs that publish more often. And like Serena and Colin mentioned, this, among other factors, can lead to the spread of misinformation, which has definitely had an impact in our COVID response and delayed our herd immunity. Another reason this is bad is because it pushes scientists towards safe, predictable, and attractive science. Basically what this means is they're just working on science that is fundable. So they're not taking any risk, and they're not really venturing into that deeply into the unknown, leading to minimal novel discoveries. A lot of scientists also think that if their studies are not statistically significant, then they are not publishable. And that, frankly, is not the case. There is a lot to learn and a lot of valuable information in the studies that do not have statistical significance. Another reason this leads to problems is because research labs will publish to keep their funders happy. So a main example of this are pharmaceutical companies and researchers publishing for pharmaceutical companies advocating for them. Next slide, please. So how can we fix this? All of these solutions have their pros and cons, and people on both sides of the fence. But one thing we could do is increase supply or decrease demand. The way we increase supply is by allocating more money to research. So the federal government can allocate more money to research, and that in itself, you can see where that can create some controversy. The other way we could do this is by decreasing demand. And by decreasing demand, you would essentially decrease the amount of researchers that are applying for funding. The way you may do that would be making the path to getting a PhD or starting your own research lab more difficult. As scientists, I think that we can see that that would be very detrimental and prevent us from learning so much more. Another thing we can do is making funding stable and predictable. So the federal government can create programs that will give principal investigators a stable timeline and predictable funding, and this will allow research labs to increase their long-term plans because they know that the money will be coming in regardless of their publications and their statistical significance. We can also fund labs and researchers rather than specific project proposals. So instead of having all the PIs submitting specific project proposals and getting grants approved for each of those, we can give particular labs and researchers a set amount of money to conduct the studies that they wish to conduct. Lastly, we can incorporate the funding system in a lottery style system. And this would just be completely random and frankly not quite efficient, but it would be fair to all the researchers applying. So as you can see, there is a lot of controversy with all of these solutions, and these are just to list a few, but the conversation still continues. Thank you. Next slide.
All right, so how can we incentivize research into health and prevention rather than treatments? Next slide, please. So already in this course, we've discussed how there's a big disconnect between our nation's spending on healthcare and the quality of care we produce. We have the highest percentage of our GDP spent on national health spending, yet we're only ranked 24th in life expectancy globally. It's important to note that 95% of our spending is on direct medical care services, whereas only 5% is on population-wide preventative interventions, which is interesting considering 40% of deaths are caused by preventable behavior patterns. Next slide, please. So some of the issues to overcome when addressing the issue of a lack of research in prevention is our society's perspectives on relative value. For public investments, they're usually contingent on their cost effectiveness, whereas medical treatments are decided upon mainly based on their standard of safety and efficacy. Another thing is the complexity of these interventions. Treatments are usually based on a single symptom or manifestation, whereas prevention targets multiple causes of diseases, which are usually linked to like an interconnected web of the determinants of health, which it can be extremely complex. Next slide. So one of the ways we can incentivize preventative research is by developing a new policy model. In our current fee-for-service healthcare systems, incentives are just not aligned with patient health. Doctors and hospitals make money from patients being sick. And if we shift to a system where it's profitable to keep people out of the hospital and to keep people healthy in the first place, prevention will become more of a value in society, and hopefully the focus of research will follow what's profitable, and therefore the focus of research will become more prevention-based. Also, we can promote prevention under healthcare policies. Next slide, please. Another thing we can do is implement population-based case management systems on the federal and state levels. These would be programs like lifestyle programs that prevent type 2 diabetes for those at risk, hypertension management programs, and tobacco quit lines, just to name a few examples. Through these kinds of programs, we'll create a new value in culture and society, and hopefully federal funding can then be allocated to research initiatives that would then support and strengthen this new value in society. Next slide, please. Another interesting article I read of ways we can incentivize prevention was written by Dr. Michael Crow, where he proposed a reconstruction of the NIH, which is the current body that allocates grants to research for basic science. He proposed a new 3-institute structure, and I won't go into the details of all of it, but the key part of this restructure would be the Health Transformation Institute. And in this institute, they would provide funding based on the production of cost-effective public health improvements versus the current model where funding is given in order to maximize knowledge production. The maximizing of knowledge production doesn't necessarily do anything for increasing public's health. So it's important that we focus on feasible goals like these cost-effective public health improvements. And in order for this reconstruction to be effective, the new NIH must have a consistency of purpose and vision. Next slide. So yeah, these were just the works we cited for research.